Hello there, it's Michael. I'm going to make a video this morning about it's a continuation of uh, some Buddhist philosophy in relation to mending yourself. Mend being, of course, move, educate, nourish, decompress, things that you should do on a daily basis. And part of educating yourself, I believe, is looking inside yourself and having a heightened awareness. And you can do this through the practice of meditation. And part of what I try to do is share with you some of my own experiences, and I have some unique experiences that many of you might not have because of the job that I have as a registered nurse. And currently, and for about the past 7 or 8 years, I've been working in post-surgery, so basically recovery, or PACU is what it's called, post-anesthesia care unit. And I get to meet a lot of different types of people. And living here in Boulder, Colorado, I've met a lot of people that actually are practitioners of meditation and yoga and Buddhist philosophy. And I've never experienced this before as I've worked in other places of the country, but I was on a hike this morning and basically, working on mending myself today, and I was thinking about this, so I figured I'd make a video. So basically, we're going to talk a little bit about, and I have this in another video on Tibetan Buddhism on my channel, about the 3 obstructions and the 4 reminders. The 3 obstructions that typically prevent us from being healthy and happy, or our own arrogance, number 1. Number 2, reactivity to things that arise in our life. And number 3, the patterns that we implement when these uncomfortable or unwanted things occur. And then the 4 reminders that kind of help keep us grounded, or the impermanence of human life. That human suffering is an inevitable part of life, and that we have to just have a good relationship with suffering. And then karma, and then basically impermanence, that that we're here for a finite amount of time, and that is all. And we should try and make the best of the time that we have here. So we'll talk a little bit about those things, but in my experience in the recovery room, I meet people that are, when you're in surgery, you're basically, especially if it's general anesthesia, you're not necessarily in control of yourself. The anesthesia doctor is doing the breathing for you. You have all of these traumatic things and painful things going on with your body while you're asleep. So then shortly after surgery being finished, the anesthesia doctor wakes you up, and then you go to the recovery room. When you first arrive there, you are in an unfamiliar environment, in an unfamiliar state of body. Very likely you're in pain. You may be having some shallow breathing because of the medicine, just you're not quite awake yet. And it's just unfamiliar, uncomfortable, and it's very distressful. So part of my job as a recovery room nurse is to help guide the patient back to a state of normalcy, as much as we can achieve, given the fact that there's going to be some pain involved. Typically, most people normalize fairly quickly. We'll say between 15 minutes and 30 minutes. They may still be having some pain, and we implement pain meds through their IV or comfort measures, this type of thing, to help people get comfortable and become to where they can tolerate the position of being after surgery. But some people handle it much better than others, and some people handle it much worse than others. So there's this spectrum. So I like looking at things at the extremes. So on the extreme of not handling it very well at all, it can be found, especially in people with some type of post-traumatic stress disorder or a post-traumatic thing that's occurred in their life. And it doesn't necessarily have to have occurred to them. Say, for instance, their mom went in for a routine surgery and didn't make it, for some weird reason. Then they may come into surgery, before surgery, exceptionally anxious. Typically, if people are going into surgery anxious, then they come out of surgery when they wake up anxious. If they go in calm, then a lot of times when they wake up calm. One of the things that the anesthesia doctors tell the patients right before they go to sleep is to think of a happy place and to try and dream of some place that you want to go or a vacation that you had and this type of thing. And it's quite often that people wake up from anesthesia telling me that they were in Hawaii, even though they've never been in Hawaii before. And that it was just the best dream and the best sleep they've ever had. So this is kind of the best case scenario. Worst case scenario are people that have PTSD, say for instance, they're veterans or they're, we can say, people in high stress type jobs like police officers, and when they wake up, they're always just at a hyper stress level at their jobs and potentially even at home, that when they wake up from anesthesia, they don't know where they're at. They have this fear response and this fight or flight. They have to protect themselves. Which is in actual stressful situations, this is a good tool for them to have. But sometimes it exhibits in places that it's not optimal. So on a hospital gurney post-surgery. So at that point, it's our job as recovery nurses to let them know that they're safe and to keep them safe, to keep them from swinging or hurting themselves or jumping out of the bed or this type of thing. And like I said, that this doesn't happen often. This is the kind of the worst case scenario. But I think that this is because they have just this heightened level of stress all the time. That could be one reason. Another thing is just that they can perceive stress differently. And this may be the people that actually didn't have highly traumatic events, but they just perceive stress differently, and they go in with a high anxiety. So we can look at the other side of the coin, and this would be people that come out very calmly. And some of the calmest people that I have met after surgery have been people that have had a high exposure and a long time exposure to meditation and to self-awareness and to grounding themselves, as they say in this Mahamudra training that I'm learning about. Reginald Ray is a gentleman, and I mentioned him in the other video that I have on this topic. And there's I think it's a 32 CD course that you can purchase online. They even sell it at like Walmart.com. And it was a very good investment. So if this is an interest to you, I would recommend that series. And this is not something that you're going to learn quickly. I have been studying this for probably 6 or 7 months now at this point, and it's been very beneficial to me. So let's just go back to the Buddhist type of reaction post anesthesia, and these people, they are actually in physical pain. If you have an incision in your body, you're going to be in pain. But a lot of times, what I'll find is that these people require minimal to no IV narcotics post-operatively. They're very calm. Their respiratory drive is exceptionally stable. And a lot of times they'll even say, rather than give me pain medicine, let me just try and focus and breathe and just kind of stabilize before we go with any more pain meds. And then sometimes they require pain meds, sometimes they don't. And I've also had patients that very shortly after, I'm not talking about huge major abdominal surgeries, but like some type of a hernia repair or something like that. They may come out and they actually want to do yoga. And I'm not a yoga practitioner. I probably should be. But it has just something to do with the mind-body connection. And it's just it's stability and consistency and familiarity. And this is something that they have equity in. They have built this integrity within their practice of their body and their mind, and even in very high stress situations like post-operatively, they're able to handle stress very, very well. And I think that this is something that that we should consider in the high stress life that we live, and everybody does. And I can even give you an example. Last night I worked 13 hours. It was a moderately difficult day, and by the time the end of the day was here, it was like 9 o'clock at night, and I was leaving work, and I was stressed out, and I was heading to go play some poker with friends, and I decided to stop at McDonald's and to get a coffee, and I wind up buying some chicken nuggets and some fries along with the coffee. And when I did this, I knew that the reason I did it was because I was self-soothing. I was trying to comfort myself after a stressful day, and I also got a phone call that was exceptionally stressful right as I was leaving work. So basically, I had a stress reaction, and I implemented an unhealthy pattern. And ultimately, if I do that enough times in my life, I'm going to have a negative repercussions from this. But at least I have an awareness of while I'm doing it, prior to doing it, and if I choose to do it, I don't necessarily feel exceptionally guilty about it. I just accept the fact that this is the unhealthy tool that I chose to decompress from the stressful situation I was in. I don't think that the highly grounded person that meditates in yoga and makes really good decisions for themselves, which is what I aspire to do and what I try and help people do. I don't necessarily think they would have made the same choice I made last night. And out of all the people that I met, there was this one lady, and I'm not sure how old she was, probably 55 or 60. She was in very, very good health. She handled post-op recovery very well. And I was asking her some questions about just her health, overall health in her life. And she actually didn't start meditating or doing yoga till later in life, 30s or 40s. And basically she says, some of the things that I recommend: moving every day, drinking primarily water, nourishing your body. All of these things. And I asked her specifically about her meditation and yoga practice, and her yoga is primarily her source of moving and strengthening her body and trying to heal her body and stretch and all of these things. But she says that her meditation practice is twice a day. It's 20 minutes a day. It's 40 minutes a day. It's 20 minutes in the morning and then 20 minutes at night. And in the morning, she focuses on what it is that she's trying to achieve for the day, and how she can how she can have a successful day that day, and basically creates kind of a plan and looks within herself to determine are there any stresses or any things that may prevent her from achieving this, and she tries to instead of escape from whatever those things are, she tries to face them and to make a plan to deal with them in a healthy, productive way. And then at the end of the night, she uses that 20 minutes worth of meditation to decompress her body and to put in a state of relaxation before going to bed. And this is a very, very high level of awareness, and it seems simple. It seems like, well, why doesn't everybody do that? Why isn't that just standard protocol? We wake up in the morning, we go to the bathroom, we brush our teeth, we grab our coffee, we're doing this, we go down the list and we get out the door, and hope that we didn't forget something important before we head off to work. And then we get home and we're watching TV and eating crap, and then we go to sleep, So not everybody does that. Some people some people make better decisions, and that's what I'm trying to say. I think that maybe we should consider doing some type of in the morning, instead of the first thing you do, wake up and brush your teeth, the first thing you should do is maybe 5 minutes of meditation, 10 minutes of meditation, and then increase it to 15 or 20, and do that and have bookends in the beginning of the day and the end of the day. And I recommend journaling in this way as well, but maybe the meditation might be better, so that you can kind of internalize and just focus on your body, focus on your mind-body connection, focus on your breathing, focus on what it is that it means to be you physically and emotionally and mentally and spiritually, and these types of things. And I'm not necessarily sure if you can do that while you're journaling. I don't think you should not journal and to not document, because actually the writing with the pencil is reconfirms with your mind that these are goals that you have, and just that physical activity is a trigger for success. But I think that also the meditation and the internalization and the awareness of your mind and your body is an important tool as well, as far as the E in educating yourself. So that's all I'm going to say about this right now, and I hope I wasn't too wordy. So anyway, mend yourself, move, educate, nourish, decompress, and have a good day.